Hi, this is Brian Kim. I'm going to share with you episode number 2 in the From Good to Great series. And this episode is going to focus on positioning, both patient positioning as well as surgeon positioning. So patient positioning is important because this allows us better access to the eye so that we have easier access to perform the cataract surgery safely and efficiently. You don't want to be fidgeting around with the microscope in the chair. And so I'm going to show you my technique on how I do this. And then secondly, which is probably even more important, is surgeon positioning. I remember when I was a medical student, an ENT doctor said, you'll be doing this examination thousands and thousands of times, and this patient's going to go through this maybe a few times in their life. And he brought up a critically important point. He said, make the patient adjust to you, not the other way around. We're so used to trying to cater to the patient, but remember, if the patient's a little bit uncomfortable, but it's so that you can be safe and comfortable so that you can do this thousands of times for your career, then you need to do that. I know it sounds a little counterintuitive because you're thinking, oh, I don't want to make the patient uncomfortable. But remember, this person's going to go through this a couple of times. You're going to be doing this thousands of times. Have the patient adjust to you and make sure you're safe and comfortable so you can continue to do this throughout your career. So let's start with the patient positioning. First, you need to have the eye perpendicular to the microscope, and this gives you better visibility, easier maneuvering. This will be more efficient. And in the South, we say piddling, which means you're just kind of wasting time. You're kind of dabbling here and there. And that means, you're positioning your chair, you're positioning the microscope, you're repositioning constantly. And that's not really efficient. And then you'll have better ergonomics, and then also even something like better toric axis alignment. So this is a patient's eye. You can see the patient has a perfect perpendicular approach to the microscope. And you know this because there's equal exposure of the limbus to lid distance on both sides. On the upper side of the lid and the lower side of the lid, you can see the speculum is retracting the lid, and I have equal exposure of that distance. And that means you're nice and centered and straight. This might mean you have to turn the body in reverse Trendelenburg. I remember in residency, we were told you don't want to put the patient in reverse Trendelenburg. This is going to cause posterior pressure and it's going to make surgery really dangerous. Honestly, I find that to be completely not true, especially with our sophisticated machines that really provide excellent chamber pressure. And now you have machines that provide dynamic and active intraocular pressure control. I find this completely not true. And so I do reverse Trendelenburg all the time for my surgeries. I haven't had any trouble or complications with posterior pressure or any of the sort. And remember, the most important thing is you want to be comfortable. You don't want to be distorting your body, contorting your body for the patient when you'll be doing this thousands of times. And then secondly, surgeon positioning. Now, this is the dilemma. You have to reach the surgical microscope oculars in order to do the surgery. And so oftentimes people crane their necks forward, as you can see. There are some microscopes that will offer this extended ocular and all of these other kind of tricks in order to navigate around it. The reason why this is a problem is gravity imposes a normal force. When you crane your neck forward, you're going to cause stress on your neck. And so it's very important to keep your head and neck vertically aligned with the spine. So here's a quick cartoon that really illustrates my point. Imagine this is your head and this is your neck or your spine. You can see with this positioning, the normal force of gravity is straight down and you have perfect alignment of your head and neck. If you turn your head down, now your neck is actually back and your head is forward. And so therefore gravity is imposing a normal force down on your head. And because it's off axis and it's not quite centered, and because your head and neck are not aligned with the gravity, now you're going to have to use your neck muscles and back muscles to exert a backward force to compensate for this gravitational force. And so again, this is that person who's craning the neck forward. This is really bad. You see the spine is straight up and down, and also the normal force of gravity is up and down, but the person is craning their neck forward, and you can see the angle is like this. Therefore, that requires activation of the neck muscles to keep the head from going down because of the force of gravity. And this constant activation of the muscles can cause spasm and problems long term and neck issues and pain. I pulled this from the American Academy of Ophthalmology website, and you can see, unfortunately, this is really not a good illustration of proper technique. You can see the person is leaning forward, and you can see how the spine is not aligned with gravity. And so therefore, gravity is going to exert that normal force down, and also you can see the neck is tilted a little bit forward, and that's going to cause the neck and the body to be pushed down, and therefore the person is having to activate their neck and back muscles to pull upward, fighting gravity. And this constant activation of muscles can cause spasm and problems. Now, in this picture, you can see the surgeon is nice and straight up and down. It might not be a big deal if he's doing only one 10-minute case all day, but of course, he's probably going to be doing dozens of cases or many, many cases throughout the day. And by keeping the back straight up and down, this person is having to activate their lower back muscles. And that over time can cause lower back strain and lower back problems. And that is what I actually encountered. I knew about my neck and keeping my head straight up and down, but throughout my career, I try to keep this stiff, straight up and down position like a flagpole straight up and down, and it caused problems. So this is how I perform cataract surgery now. Now you might say, oh my goodness, what in the world is this guy doing? But I will explain to you why this makes more sense than any of the other surgeon positions that I just showed you. But before I get to that, let's think about what I'm doing here. I have really good positioning of the oculars right against my face, and I'm also nice and parallel. My eye, my line of sight is nice and parallel to the ground. I'm nice and straight. However, in order to do that, you see I'm having to turn the microscope really far away from me. And I have to do that because, and I'm leaning my body backward like I am. I have to position that microscope in that way. By turning the microscope away like that, I don't have to maintain that straight up and down stiff position, but I do have to adjust the head of the patient. And you're going to see here, this is how I typically position the patient's head. You can see the head is turned all the way towards me and the head is taped down. And so the patient does have to have more of a turn towards me in order for me to have a good position of the microscope aligning with the patient's eye, so I can have excellent patient position, but also excellent surgeon position. So again, let me explain here. Again, I have a nice horizontal line of sight, and my head is straight up and down. Actually, it's tilted back just a little bit, but you can see that my neck is actually straight up and down. I don't know if you can tell that. I'm straight up and down, so I'm at a right angle with my eyes going straight across, level with the ground, and then my neck is actually straight up and down. Now you might say, what's the deal with your back? Your back is really kind of skewed at a funny angle. Well, the reason why this works is I have excellent lower back support. Take a look at my surgeon's chair. The back of my chair is providing excellent lumbar support right there. And because of that, I'm able to lean back. I have good back support. And as a result, I'm very comfortable. My legs are splayed out. It's like I'm sitting in a lowrider car. I'm lean back. So you can see now I have the patient in front of me. I have my legs splayed out. I have the ocular straight parallel to the ground, but you can see the portion that goes towards the patient, the microscope light, is angled away from me. But the patient's head is turned towards me. You can see the lower back is supported very nicely by the surgeon's chair. And you can see from a vertical position, my head and neck are aligned with that chair support. And that's the key. My chair is directly underneath my neck and spine, my cervical spine. And because of that, I really don't feel any tension or strain on my back. This is the other side. You can see, again, my head is straight up and down. My oculars are nice and straight. You can see the portion of the microscope that's towards the patient is angled away. Of course, the patient's head is turned towards me. I'm leaning back. I have good lumbar support, and that point of support is directly underneath my neck and my head. And when I do surgery, and I've been doing the surgery this way for the last 10 years. Again, early in my career, I had a lot of upper back and neck pains, and I switched to this technique, and I've noticed I have really good support. But you see the screen here? I'm showing that I have excellent patient positioning as well. I have equal distance between the limbus and lid on both sides there. I'm showing you on the other side now, the same thing. And again, as I was saying, in the beginning of my career, I had a lot of neck and upper back spasm problems. I didn't know exactly what the deal was, and I've tried to do a variety of different things, but this is where I've landed on. So over the last 10 years, I've been doing this kind of low rider, kind of leaning back surgery positioning. It's a little bit cumbersome for the surgical techs because they have to negotiate around my feet, but I have really comfortable positioning throughout the day. I operate, in the mornings, and all throughout the day, I don't really have any trouble. Again, you can see that positioning and look at the eye. You have equal exposure, limbus to lid on either side. That means the eye is perfectly perpendicular to the microscope light. So again, I've been doing it this way for 10 years. I don't have any neck pain or back pain anymore. Now, I still have troubles because I have to get into the slit lamp and I have to do a variety of other procedures. I do blepharoplasties and other eyelid surgeries. And, when you're using loupes, you do have to hunch over. And so I'll get spasms when I do those procedures. But when it comes to anterior segment surgery, using the microscope, how I'm doing here, I'm able to keep my head and my neck in the neutral position, looking straight up, never tilting down. Again, I'm trying to make sure I'm right balanced with that normal force of gravity. I'm able to keep that position mainly because I have that excellent lumbar support with the surgical chair by leaning back, and I have my head and neck in that position. So those of you who are having neck pains or back pains, I know this looks like a very strange way to sit when you're doing surgery, but again, think about what I said before. Even though you're keeping your head straight up and down when you're doing surgery and you're looking straight ahead, if you're keeping your back straight up and down and stiff like a flagpole, you're having to activate your back muscles to do that. And when you're activating your back muscles all day, it'll catch up to you. Maybe not in a few weeks, months, even a few years, but decades, it's really going to catch up to you. So by doing it this way, I really have alleviated a lot of my problems. And again, remember, surgery as a career is not a sprint, it's a marathon. And remember, you're going to be doing this thousands and thousands of times. This patient's going through this twice. So have the patient adjust to you, put them in whatever position you need. If I'm turning their necks towards me, that's fine. You might say, oh, well, that looks uncomfortable. Well, the patient's going through this twice. You're going to be doing this thousands of times for your career. Protect your body, have good positioning, good ergonomics, and as a result, you'll have more longevity and be able to better care for your patients. So I hope this was helpful to you, and I thank you for your attention.